Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about respiratory alkalosis. You call it as alkalosis when the blood pH goes above 7.45. Normal blood pH is 7.35 to 7.45. If the blood pH is less than 7.35, it's acidosis, and if it is greater than 7.45, it's alkalosis. And you call it as a respiratory alkalosis when the carbon dioxide level drops less than 35. The normal carbon dioxide level is 35 to 45. Now, how low carbon dioxide level can lead to respiratory alkalosis? Carbon dioxide, which is formed in our body as a byproduct of metabolism, and in blood it can combine with water to form carbonic acid. This carbonic acid is a weak acid and splits into hydrogen ions and bicarbonate. So the carbon dioxide level in our body can increase the hydrogen ion, which is acidic in nature. So what happens if the carbon dioxide is less than 35, less than normal? There will be less hydrogen ion, which is acidic in nature. If there is less hydrogen ions, what happens is it can lead to alkalosis. So remember, respiratory alkalosis, there is low carbon dioxide level and the blood pH goes up. So now what about the bicarbonate? Bicarbonate may be normal, but if the compensatory mechanism is involved, our body has a compensatory mechanism to correct the blood pH back to normal. Then the kidneys are involved and it will remove more bicarbonate, which is alkalosis in nature, so that it can lower the blood pH. Now let's see what are the causes of respiratory alkalosis. The main causes of respiratory alkalosis is hyperventilation. That means increased respiratory rate that blow off the carbon dioxide that can increase the blood pH. So what are the conditions that can lead to respiratory alkalosis or hyperventilation? High altitude. In high altitude, low oxygen level. As a result, body tries to compensate by increasing the respiratory rate. Aspirin toxicity, pneumothorax, collapsed lung or embolism in lungs that can lead to hyperventilation, pain, anxiety, fear. It all can increase the respiratory rate. Neurological damage. When respiratory center of the brain is damaged or inflamed, it can alter the respiratory rate, can cause hyperventilation, blow off the carbon dioxide level. As a result, it can lead to respiratory alkalosis. What are the signs and symptoms you will see in respiratory alkalosis? You know, hyperventilation is main cause. So you will see increased respiratory rate, tachypnea, and you will see a rate greater than 20 beats per minute. You will see increased heart rate, tachycardia, anxiety, fear, and in severe cases you will see seizures. You will also see electrolyte imbalance like hyperkalemia and hypocalcemia, which can lead to the signs and symptoms include tetany, muscle cramps, and dysarrhythmia. Now, how respiratory alkalosis can lead to low potassium and low calcium. Hypokalemia occurs. Remember, in alkalosis there is low hydrogen ions. So the body tries to compensate it by moving potassium into the cells in exchange of hydrogen ions. As a result, potassium level in the blood drops. Now, how come hypocalcemia happens? So there is less hydrogen ion in alkalosis. There will be less hydrogen ions binding to albumin. As a result, more albumin is available, and this calcium binds to albumin that can lead to decreased free calcium or ionized calcium in blood. Now let's see what are the treatment of respiratory alkalosis. Always treat the cause. You give supplemental oxygen to bring down the respiratory rate or to decrease the hyperventilation. Anti-anxiety medicine to treat anxiety or sedatives to decrease the hyperventilation. Monitor the electrolytes, potassium and calcium, and replace as needed. You can instruct the patient to breathe into the paper MAC or a rebreather mask, which helps to rebreathe the carbon dioxide and to slow down breathing. So today we learned about respiratory alkalosis, and thanks for watching my video.